Hello, everyone, and welcome to another episode of Auditing Antics. So today we're going to be touching base on advanced beneficiary notices. That's a mouthful. We like to call it an ABN, much easier. But basically what this is going to cover is the scenario when we have patients coming in that are potentially going to receive services that may not be covered. And we're going to look at it heavily from the CMS perspective and what they want that workflow to look like in the practice. But there are going to be times that commercial payers will have something similar, or they may direct practices to follow CMS. So, Michelle, why don't you start out by giving us the overview of what an ABN is and what the purpose of this document is? Oh,
Yeah, I
okay, you
realize
got
now.
it. You got it. Okay.
So, like Stephanie said, we like to abbreviate and call this an ABN. So that means Advanced Beneficiary Notice of Non-Coverage. And what this is, it is a written notice that's intended to inform a Medicare patient specifically. So a lot of this is specific to Medicare, unless, like Stephanie said, the commercial payer gives instructions for their own ABN form or to follow the CMS guidance on this. But this is a written notice to inform a Medicare patient that Medicare may not cover the service or item that the doctor is instructing them to do. So, whether it's a certain type of care or a certain type of test, a lab, a certain procedure, there's many
Could
different
be
scenarios.
frequency.
Yes,
Over
frequency.
frequency, yeah.
Um,
PT and chiropractic care, that happens quite a bit. If you've reached what they will consider covered, then you could choose to move forward, but you may have to pay out of pocket for that.
Correct. So this is to inform you that this may not be covered by Medicare and that you will be financially responsible to pay for that service. So you will pay out of pocket for that service if it's denied by Medicare. So, this really is intended to give the patient time to review their options and make decisions about their care. And it's not intended to be given to the patient at the time the service is being rendered. It shouldn't be like, okay, you need to get this MRI. Here's this ABN to sign because Medicare may not approve it while you're waiting to go in for your MRI. It's intended to be given ahead of time by a professional who is qualified to talk to the patient about what an ABN means. We should never be giving the patient this ABN and saying, sign here. You need to sign
Yeah,
this in order to get this. You need to be taking the time to explain to your patient what service is what service you think will be denied by Medicare, why you think will be denied, and giving them time to make an informed decision about their own care.
yeah, and one other thing too that really needs to have an estimate of costs, because as a part
Yes.
of making this decision, a lot of times it comes down to the financials, right? So the patient needs to know, okay, if this is $50 and I can afford 50, then great. If this is going to be 500, 1,000, maybe I'm going to question whether or not I want to move forward with that. And, Michelle, I want to go back to something that I think you actually brought up on the last episode with the workflow and practices, and the way that a lot of times when they need a document signed, we don't actually even physically see the document anymore. They have that little electronic pad and they say, oh, see that, black pen or whatever it is over there? Please take that and sign that pad. So they may
Yes.
say, like you just described very quickly, oh, please sign this. Your insurance may not cover. The average
Or
person's not going to
consent to
know.
care. You
Yes.
need to sign
Yeah.
to consent to care. I have heard that before. And anything like that should be an automatic pause. An an ABN should not be presented to you in time of emergency. That is not the purpose of an ABN, and it should not be presented to you at the time of service. So if you're being asked to sign anything, it's at a time that there should it should most definitely be appropriate that you say, I would like to see what I am signing before I sign it. And they provide you with that information. And it's okay to ask questions if you don't understand what's on that form. And it's okay to ask to speak to a different person if the answer you get is, oh, I don't know. People just usually sign these. And
Yeah.
that,
Why
I
are
mean,
you asking?
I spent 13 years in banking where we gave disclosures galore, and I always made sure to take the time to at least give an overview of what this disclosure meant. Some people didn't care, other people wanted to take the time to read it line by line. But this is
Yeah.
very similar. It is appropriate to say, hang on, I would like to see what I am signing and have a moment to read through that before I sign those that paperwork, just so that you as the patient can make sure that you're not caught up in that workflow of just sign here, go have a seat, and we'll be right with you.
Yeah.
It's okay to say, wait a minute, I need to take a minute and look through things.
So one of the things too that I want to clarify that you brought up, so the ABN at the time of a procedure, for example, that's something, and we had a comment here that it happens a lot with the toenail debridement, and that's right. There's very specific times that that's going to be a covered service based on policies that, yes, us in the industry are aware of, but this is a part of the practice's responsibility as well. And one of the things to keep in mind is that if you what we're talking about when we say that you shouldn't have this upfront at the time that you present for that service, what that means is kind of what Michelle was just saying a second ago here. You shouldn't be going in, being brought to a room, the room's prepped for the procedure, and they say, oh, by the way, we need you to sign this before we move forward. No, what should be happening realistically is at the time that the provider's deciding that that's an appropriate treatment for you and you're talking through your options, you need to be told at some point, that this is going to be a possibility so that you can think about it. It can happen on the same day. Maybe that pause takes place and then you decide if you want to move forward with it that day or, later. But that pause is a really large part of this because it shouldn't be rushed. And the point is that you know that you're taking on the cost as the responsible party. Now, another thing too, I want to talk a little bit about that concept of who it is that is, let's say trained or eligible to have these conversations with the patient. Because a lot of times when there is that rushed workflow, I find that it's the front desk staff that's doing, 10, 15 other things, multitasking, all of that. So, what are some examples of somebody in a practice who really should be having the conversation? And I will say, Michelle, I know both of us are aware of this from our time in education and auditing and all of that, but the providers don't like to be the one to have to do this. They don't want to say, this is what you should have. Oh, but let me pull out this form so we can talk about the cost. We're fully aware a lot of times in practices the providers want to be hands off, especially if
Mhm.
they work for a multi-specialty group, a hospital system. There's finance departments, coding, billing, all of that for other reasons, and they prefer to keep the finances separate. So, what are some examples of the type of staff that should be having this conversation with the patient to get the appropriate signature?
So I feel that it could be a range of staff members. It could be either the provider themselves. The provider would need to be able to answer questions regarding the cost to the patient, or what is an ABN and how does this work. The person who is sitting down with them should be able to speak to what what is this form that we're signing it, and why do I have to sign it. It should be somebody who is really involved, which I guess this would come from the provider, but what are the treatment options? What are my options for treatment? So in the case of a toenail debridement, there may not be other treatment options for that person, but they should be able to answer any questions that are presented about the form. And that could be really anybody in the office. I don't think it necessarily needs to be somebody clinical, but if somebody doesn't know how to answer, okay, are there any other options for me? It should be somebody who knows that they need to direct the patient to have a conversation with their provider before signing this form. I have
Yeah.
seen several different types of workflows. I have seen it taken out to the front desk for checkout time, like when people check out, if it's something that's planned for the future. I have seen even a whole stop in the EHR. So this was an Epic, for example, and the provider is ordering a service and it has identified that this may be denied. The whole system stopped and required them to print out an ABN. And well, technically, the workflow was supposed to be print out the ABN, discuss it with the patient, and the system wouldn't allow them to move on until they had answered the appropriate questions surrounding the ABN. I've even seen nursing staff discuss this workflow with the patient. So I feel like it really depends upon what works for your practice and who do you think is most qualified to present this to the patient in a way that they will understand, but also know when they can't answer that question and be able to direct the patient to somebody who can help them before they sign that form and make the decision.
Yeah, and this is something too, from the practice workflow perspective, ABN should not be used across the board for every
No.
patient all of the time, just in case as a safety net. This is something that's intended to be used when there are times, for example, a service could be covered, but the particular scenario, whether, like you said, whether it's diagnosis, frequency, that scenario is causing that unknown possibility that that claim may be denied. So from a practice perspective, we don't want to have things set up where, for example, an ABN is filled out ahead of time for every
Mhm.
single patient with generic information in there. This needs to be specific to the patient, to the service. Again, a part of that education is making sure they're aware why that service may not be covered. So, for example, there's going to be times where procedures are always considered cosmetic. There's never a time where it's going to be covered. Or
Yes.
there may be things like, I always think back to the wellness visits because our typical preventative visits that we think of with a physical exam, that's we know that that's never covered. That code set is never covered by Medicare. It's a different code set. So that also is not necessarily an ABN scenario because that preventative exam starting with the 99 code is never covered.
Mhm.
So we need to think about the specifics of when it's appropriate. It's going to differ depending on specialty and the group that you work with, and it can be specific to patients. So, one of the things that is important as well is that you have to remember that if you're dealing with something in PT, for example, or chiropractic services, when it's a frequency issue, there has to be a tracking mechanism in place for this. If somebody in that office is not paying attention to number one, what the limitations of coverage are, and number two, tracking how many times the patient has had that service, getting near to the point where they may need that ABN, that can also result in a lot of loss of revenue just from not having different things set up by the staff in the workflow. We have a comment here from Dr. Rosenstock. This is a good one. So he says, Stephanie, could you discuss the provider obligation to submit the claim along with the appropriate modifier appended? So this is a huge part of this
Yes.
part of billing when it comes to the revenue cycle, the ABN, the process, how it flows into the reimbursement is the modifiers. So Michelle, do you want to touch base on what those modifiers are?
Yes. So there's actually four different modifiers that you have to choose between when an ABN is involved. So the first modifier is GA, And this is used when the service is expected to be denied because you think it does not meet the Medicare requirements for medical necessity, and you have a signed ABN from the patient. So, for example, Stephanie has mentioned frequency. So maybe you're ordering a test and you know that the frequency requirements for Medicare is, we'll say, 5 years, but only 3 years has passed since the patient has had this test. The ABN is issued, and one of two things is going to happen. So on the claim, you're going to report the GA modifier for that service. Medicare is going to review the claim, and they will either pay or deny that claim. So if Medicare pays the claim, the ABN is irrelevant. If they deny the claim, then the patient would be financially responsible for that service.
And
So the
one thing I want to highlight there quick too, this is a scenario. So I didn't mention a little bit ago that some of these are voluntary for the practice, right?
yes,
So
and that was
when
the
I was
next modifier.
okay.
Mhm.
Yes, so this
Yep.
one, when we're talking about the GA, that means that that one's not voluntary. Either the practice is obtaining this and you're showing the payer that you have that by adding the GA, or you're going to be
Mhm.
out on your reimbursement. It's not something that you can say, oh, they didn't pay, now I'm going to bill the patient. Because remember, that's something that's going to come up after the fact when we have our remittance letters, all of that fun stuff there. But yes, moving on into the voluntary area where the practice can choose to do this, which, Michelle, I do suggest that this is something that really helps with customer satisfaction. They may
Yes,
not like
I
that they
agree.
have to pay, but if it's voluntary and you're letting them know up front, you're still giving them the choice to deny the service if they don't want to pay for that out of pocket. Oh, you're on mute. Try it now. Okay, so I'll move on to the voluntary. You work on your audio. Sometimes my button does it too. So with the GX modifier, so this is the one that is voluntary, and this is when we know that the services are not going to be covered. So what this is going to do when you're submitting that claim is pretty much they're going to auto deny that. They're going to see that GX on there. It's going to create a denial, but it will put that into the status of the patient needing to reimburse or pay for that service themselves. Now, with the GY, that's what I was talking about with what they call statutorily excluded. So there's going to be situations where, again, it may not be necessary to issue that ABN, but it's going to help a lot from the perspective of the patients making their informed decision. So think about that process. When the patient receives a bill, they end up calling, they're really upset. They don't understand why they have to pay for, let's say, that lovely scenario of the preventative physical examination versus what we know to be a wellness visit. Those are two very separate things. And, I've even worked with providers and groups where they don't want to go through all of those steps of what, is involved in a wellness visit. So they will just go ahead and they will do the annual physical exam and they'll bill it out, and it's something that we know is never going to be reimbursed and the patient has that cost. So that's a situation that could result in that surprise out of pocket balance, and we want to be really mindful of that. Now, lastly, we have the GZ modifier. So this is used when we expect it to be denied, and there will be automatically a denial basically at the time of claim submission. So this is something that the ABN is not issued to the patient, you do expect the denial. So, that sounds very similar to what we were just talking about here, but the point is if you have to implement this into your practice, you want to be aware of what is a mandatory scenario for an ABN and what you're able to do from the perspective of voluntary. And then you need to make that administrative decision as to how you want to handle that for your patients. Now, we have another question here. Would we ever use these modifiers for commercial payers? Say a commercial insurance doesn't cover something that is primary and the patient has Medicare secondary. Yes, so this gets very, very tricky because when we throw commercial payers into the mix, they don't always, in every scenario, have to follow CMS. What I mean by that is if you're dealing with payers that are an Advantage plan, like a Medicare replacement plan, there are definitely situations and guidelines and all of that that will show that they have to follow the CMS guidance. But when we have just straight commercial payers, you're dealing with Blue Cross Blue Shield, maybe United Healthcare, any of those types of plans that are coming from the employer, or maybe you're purchasing that yourself through that healthcare exchange. All of those types of things are going to really, unfortunately, be up to that payer. So, one of the things that I always suggest when I'm working with my clients is that we need to dig in and see what they have in writing. The reason that I say that on the commercial side is because if we are in a situation, let's say that a claim has denied, they've said the patient's not responsible for it, and they're also not going to reimburse it. That's going to put it in a situation where if we try to go back and appeal that, we need to know what their written guidance is so that we can appropriately do that. So there are absolutely times that the commercial payers will have different types of guidance or maybe even a whole different form that they require for non-coverage, but it's not something we could say across the board, even use Medicare's ABN for every single patient, because that may not be applicable to the commercial insurances. Now, to address the part of the question when the patient has Medicare secondary, you're still going to have to be aware of that and go through their required process, because if it does go to that commercial payer, let's say they completely deny it, then we go on to Medicare secondary, we could still end up in that same claim scenario where we're going to have the ABN, and they're going to want to see all of that different information. So, a lot of times, and I feel like I'm saying this a lot lately, I've done a lot of different presentations and webinars over the past 2 weeks. And it's one of those things where some of the scenarios that we deal with in the industry, we're not able to, really give blanket answers across the board. So to some extent, you're going to have to go in and you're going to have to research that based on payer. And you can do that on public sites. You can do that in the provider portal. You'll want to look for language like non-coverage. You can put in advanced beneficiary notice. It may just bring up your Advantage plans, but you want to go in and see what the requirement is when that patient's going to have an out-of-pocket cost. Now, from the patient's perspective, one thing that I think can be difficult when we talk about this is that, as you can see, as we've gone through this episode already, it's really hard to really figure out when you need to be aware of this because of the fact that there's these different variables that come into this. So, one of the suggestions we're going to have throughout probably the majority, if not all of the episodes that we do, is that you do need to be aware of your coverage. So, if you know, for example, that you have a certain complaint or issue that you're going in, just take a look at things like diagnostic testing. I think that's a really big one. Making sure that you're aware of the frequency, the times that they will cover something as preventative versus non-covered. If you have different conditions like diabetes, for example, there can be limitations to the frequency with your providers. Now, with all of that being said, it really it doesn't do the practices any good to not properly follow an ABN process, because ultimately they're the ones who can lose out on reimbursement. One of the things we didn't really fully touch on yet with a larger explanation is the fact that if the practice does not have this in place, if they choose to not obtain that ABN when it's not voluntary, so it is required, if there's an absence of that ABN, that practice is going to receive a denial, and they're not going to be able to put that to patient responsibility. So that's something too on the patient side that you could potentially look into. What one thing that is important, even outside of being familiar with your own policy, is really understanding how to read over your explanation of benefits that comes out after a claim is processed. So this can be done in a lot of different ways now, especially with the electronic options that we have out there. So you may receive a letter in the mail that's explaining this. I know for myself, I have the app. United Healthcare, for example, I have that app. I receive a notification. I receive an email that a new EOB is ready for me to look over. So, what that means when it's the explanation of benefits, that's your insurance trying to explain to you, as that consumer, as their member, how that claim went through the system and what the outcome of that was. So even if you are somewhat confused about, the different specifics we're talking about that, really do play into the clinical side and the workflow of the practice, you can take a look at your EOBs, and they're going to say in there, you may be billed this portion from your provider, or whatever language that may be. It may say out of pocket costs, anything like that. That is what you're looking for on those explanation of benefits. And when you are logged in, if you've never logged into your insurance plan in their member website or portal, whether it's an app, on the computer, an iPad, whatever it is, you want to log in there, because they're going to show each of your dates of service. They're going to show the information, that billing that's taking place, and that's where you're going to see what I'm referring to here as that out of pocket cost. So it's really important to make sure you're looking, because let's say you do have a situation with a frequency issue and you've been going to PT and you reached your limitation, they did not obtain the ABN from you. This happens a lot with chiropractic actually as well, and they process that claim. They don't have the ABN to support the fact that they told you about that and let you make a decision, because all of this is about the fact that you, as a patient, have the right to deny that service if you know that that is going to be considered uncovered or not medically necessary, all of these different terms that a payer can use. So if in that situation, let's say that you're looking at your EOB and you see that it says that the patient out of pocket portion is zero, but then you receive a bill from your provider for that same exact date of service for, let's say, $250, you need to call in and question that. You can call the practice first, try to work with them, but if you don't get anywhere with them, there may be times that you have to reach out to the payer directly. So that's a way from the consumer side to be informed on both ends and make sure that you're really tracking. It's one of those things, I wish I could say that you shouldn't have to do that, but you do have to do that. And that's why there's also, this large disconnect in the industry in general, because a lot of people don't have this knowledge and they don't know when or where to reach out or any of those types of things. So you want to start with your practice if you don't understand what's coming in on a bill. And then from there, if you're comparing it into again, your membership website, where you look at that date of service and it's not matching what your insurance company is saying to you, that's a problem and you need to address it. You can also call your payer if you feel your practice is not listening to you. You can call the customer service and talk to them as well about the way that that has basically ended up in the revenue cycle on the practice side. All right, so that's the last of what we have today for the ABNs. As a quick reminder, we do have the email address set up. So if you have any questions, we would also love some feedback on future topics. Michelle and I have a list of a lot of different things that we tend to experience often. But if you have any suggestions or things that you would like to touch base on, let us know. We have the Auditing Antics Gmail set up, and then you can also comment. I'll take a look at the various locations where we have this going live, and we do now have the podcast on Apple, Spotify, Amazon Music, and Audible. So take a look there as well, and let us know if there's anything you'd like to hear in the future. Thank you.